So we've got our prescriptions ready. Another thing that we need to do is formulate a list of questions. And so when I was doing my research to speak with you, I found that the Department of Health and Human Services has a website and a little handy tool called Build Your Question List. And you can build a list about prescriptions or a test you might be going to be taking, a diagnosis you've received, your treatment or surgery, all different kinds of questions, a list of questions that you can ask your doctor. And later on, I've made some handouts, like last time, and that Build Your Question List is on there. So now we're prepared to go. We know we've got our list of drugs and our formulary, and we've got our list of questions. What should we do at our exam? Well, the first thing we need to try to do, if we can, is to build a relationship with our doctor. And I know that's a two-way street, but we need to give it every effort. So first, be an active participant and listen to what the doctor says. And if you don't understand, no question is too simple. Ask questions. Don't be afraid to ask questions. Another thing that people sometimes are afraid to do is if your doctor tells you, recommends a treatment for you, and you don't think that you'll be able to see it through, they just accept it and don't say anything. Well, tell your doctor truthfully if you think you can or cannot follow through on your treatment. And maybe he'll have different options or something to help you succeed. So then, on another light, if you're taking a child or another family member, maybe someone that doesn't understand why they have to go to the doctor, prepare them in advance if they're going to have tests or exams. Tell them why they're going and what to expect. And this is especially important with children. Now you might be thinking, why should I partner with my doctor? Why should I try to help him out? Didn't he go to medical school? Or why are we paying? We're paying them. Shouldn't they know what to do? Well, remember, your doctor knows about medicine, but you know about yourself. So combined with the medical facts and your personal values, you should be able to get better care. So now we've prepared and we've been to see our doctor. What happens if we need to make a decision? Well, there's some steps and guidelines that the HealthWise system has developed. And first of all, you need to ask your doctor what your choices are and your options and what decisions he's going to need from you. Then, armed with this, ask him for information, whether he has handouts about your problem, or you can go to the library. I have this excellent book that our insurance company gave to us, and it's more of a family medical book, but it tells what to do, when you should go see a doctor, when you need to go see a doctor. But there are other books out there that are very specific about problems that you might have. And also, if you choose to get information on the internet, look for reputable sites like the National Health Institute or the Center for Disease Control, the Mayo Clinic, and WebMD, but don't look particularly at one study or possibly a company that's giving you information that's for profit. Now, one site that I found was very helpful to us when our daughter Kim became diagnosed with a serious condition was the National Institute of Health has a prescription site called Medline. And you can go, they tried various very powerful drugs on her, and you could go in and take that drug and the dose and see all the side effects that you might have. One of the things that she was taking, it strongly urged that you not eat grapefruit or drink grapefruit juice, that you could have a severe reaction. So things like this are, to be informed, are very good. Then, once you've learned a little bit more about your problem, ask yourself, what do I think and how do I feel about this? And talk to your family or a trusted friend and weigh the pros and cons of the information you've got. And then go back and share this all with your doctor. Share your feelings with your doctor. And then consider, if you make a certain decision, ask your doctor about what are the side effects? How long is it going to take me to recover? Am I going to have a lot of pain? How much is it going to cost? Is my insurance going to pay for this? Then figure out what your best choice is and make a plan. So good health doesn't just happen. You have to make it happen. And you try to stay healthy, but sometimes that doesn't work. So to get the care you deserve, you need to partner with your doctor and get that good medical advice, but you also need to share with them information about yourself. And once you do that, you should get the best possible care for you. So I hope that this helps you tonight and maybe in the future. Let's hope you don't have to face that decision, but I want you to be an advocate for yourself. All right, thanks.
Okay, good job.
All right, 11 minutes and 43 seconds.